Good evening to all. Yes, so the next remedy is ammonium mure. We have already discussed about ammonium car, so pretty close because it's coming from the same family. Some pharmacy parts should be similar. The discharge characters are similar. All right. So going ahead, we have ammonium mure, and the common name is sal ammoniac. HPI gives old method, it comes under class 5A, just like your ammonium carb, and the new method, it is drug strength of 1 by 10. Constitution, I will never ever forget in my life because I had studied this remedy, the physical constitution of this remedy, thinking of one of my classmates who had a very upper torso is pretty, she was very fat in this side upper part, but then if you compare the lower segment of the lady, that is your legs, your lower limbs are very thin, it's disproportionate, and that's how I remember ammonium mure. So especially adapt to those who are fat and sluggish, or the body large and fat but legs are too thin. Okay, so I will never forget. I'm pretty sure about that, and I think you should be also don't take in this way that you should be checking out girls each and every time. Don't think like that, but on the lighter side, I think it's nice to have material descriptions like that, so that you try to compare with some people, so that stays in your mind forever. So I'm still saying that I always thank her for that thing. I have not said to her personally, but then yes, whenever I see her name in my contact and all, then I definitely remember ammonium mure for the physical description. Alright, so you have this weird upper part is fat, and then the lower segment of the body is thin. Okay, you have this lower limb emaciation also in your marasmus kind of features and all, but here it's not something like that. Okay, here it is more of the obesity, that is abdominal visceral obesity is there, the truncal obesity. So it's more towards the obesity part in ammonium mure, but if you go for aproptanum, arsenum nitricum and all, you are going to see some kind of atrophy and wasting of muscles or your body of the lower part. Okay, yeah, going ahead, mental generals, there is desire to cry but cannot, and there is consequences of grief. Okay, so that is something that you have to remember of ammonium mure. Ammonium carb, we had discussed, there is your ill humor during wet stormy weather. Nose, we had already discussed one thing about ammonium mure in the ammonium carb. We had said ammonium discharges are acrid. So it's just like that. Ammonium mure has an acrid coryza, watery acrid coryza, corroding the lip, just like your allium cepa. Obstructed, stuffy feeling, constant and unavailing efforts to blow it out, and there is itching. Okay, so it's kind of an allergic symptom. Okay, you have acrid coryza, corroding the lip. There is obstruction, there is stuffy feeling, so there is obstruction, congestion. You have constant unavailing efforts to blowing it out. Okay, so you tend to blow it out, but it's not relieving your complaint, and it also is attended with itching. GIT, it has obstinate constipation accompanied by flatus. Now, okay, that is fine. You have hard, crumbling stools require great effort in expulsion, crumbled from the verge of anus, just like magmure. So something I want you to remember, I think everybody would be knowing that, but still, if you don't know that, please remember muriatic component shows this crumbling of stools at the verge of anus. You take ammonium mure, take magmure, take natramure, you are going to see this thing. So it is one part of the muriatic component that plays for this symptom. Okay, now that keeping aside, please focus on this symptom. The stools vary in color, no two stools alike. A very symptom of pulsatilla, which speaks for its changeability. Now, changeability, you have some remedies like pulsatilla, you have your sanicula. Now, particularly to say about stools, you have to think of ammonium mure also. Okay, so no two stools alike. Please remember ammonium mure, just like your pulsatilla. Hemorrhoids, please remember there is suppressed leukorrhea causing hemorrhoids. Okay, so you have normal symptoms of your hemorrhoids, just like sore, smarting, burning, stinging in rectum for hours after stool. Okay, that all are there, but then please remember hemorrhoids after suppressed leukorrhea. Okay, so these are the takeaway points of ammonium mure. In female, you have leukorrhea like white of an egg. In ammonium carb, we said leukorrhea watery, which is acrid, causing excoriation of vulva and all. Let's keep that aside. Now here it is ammonium mure, which says that leukorrhea is like a white of an egg. Okay. Now white of an egg leukorrhea, in keynote it is given ammonium mure. But if you go for boric, you have a lot more remedies coming up there, like alumina, you have borax, you have calcareous phos. Okay. These three are given in the boric description of your ammonium mure. And now here leukorrhea is preceded by gripping pain about the navel. It is brown, can be brown, it can be slimy, it can be painless, and after every urination. Another important symptom of muriatic part. You go for magmure, you will see this thing. Leukorrhea, aggravation every urination. So please again, focus on the muriatic point of part of the remedy, which gives few contributions of symptoms. So leukorrhea can be white of an egg, it can be looking like white of an egg, so it speaks of the whiteness, and then you also have a brown shade to it. It is painless, it can happen after every urination. During menses, you have diarrhea and vomiting. Now ammonium carb had cholera-like symptoms at the commencement of menstruation, and other remedies were your veratrum and all. But keeping that aside, Bovista also was there, I guess. Now in menses, you have ammonium mure, you see diarrhea and vomiting. Okay, bloody discharge from the bowels. Your cholera doesn't look like that. But if you see for loose stools, yes, diarrhea is there. Okay, so bloody discharge from the bowels during menses, and who is sharing the same symptom? It is phosphorus. Okay. Now other things are neuralgic pains in the feet. See, and then you have flow more profuse at night. Another same symptom of ammonium, because there also you had copious at night time and while sitting. Okay, and now here you have flow more profuse at the night time. Okay, so please always study ammonium mure and ammonium carb together, so that you have a lot of similarities that can be shared and that can be studied together. Okay, and then you have sensation of coldness in the back. Okay, sensation of coldness in the back. Yeah, so sensation of coldness in the back between scapula, you have ammonium mure, you have lactanthus. Now lactanthus in phosphorus have a description, sensation of coldness in the back as if ice. Okay, ice like coldness is given, that description is given for lactanthus. In phosphorus there is burning spots in the scapula. Okay, in phosphorus it is burning that is felt between the scapula, and the remedy phosphorus. Phosphorus again coming as a trio of burning, arsal, phosphorus and sulfur. Okay, yeah. Now going ahead, extremities, hamstrings feel painfully short when walking. There is another important symptom. This exactly is one important MCQ. Tension in the joints as from shortening of the muscles. Other remedies are causticum as well as Cimex. Okay, yeah. Offensive sweat of the feet. Okay, so there is offensive sweat of the feet. Okay, offensive sweat of the feet. Okay, there is increased perspiration, and which is offensive. Okay, other remedies are alumina, phytis, sorinum, sanicula and cyanide. Alright, I think going to the modalities, the boric have clearly given a demarcation for your head and chest symptoms, which is worse in the morning. The abdominal symptoms are worse in the afternoon, and pain in limbs, skin, as well as febrile symptoms are worse in the evening time. So please remember, this clear-cut demarcation of aggravation is given about ammonium ure in the introductory part of ammonium ure in boric. Okay. Yeah, so head and chest in the morning, abdomen in the afternoon, and then you have pain in limbs, skin, and febrile symptoms worse in the evening. Yeah, not much important. Okay, the relation here is not very important here. Few things from boric. There is thirst for lemonade. Okay, thirst for lemonade. Please remember. Okay, and then you have sore spot behind the uvula relieved by eating, and there is excessive fatty deposit around the abdomen. We said that the constitution has a fat upper torso and a lean lower segment or lean lower limbs, legs, whatever you want to say. So that, please remember, it is something that has to do with the deposition of fat around the abdomen side. Okay. Leukorrhea like white of an egg, ammonium, borax, and calcirephos with pain above the navel. In ammonium carb, we had gripping pain or colic that is attended with menses. Okay, not about leukorrhea, it was the menses side. And sciatica was sitting, better lying down. Okay, so you have sciatica was sitting, better lying. And there is neuralgic pains in amputated limbs. Please remember your phosphoric acid as well as allium sulfur, okay, which also have this amputation neuralgia that can be seen. Okay. Leukorrhea like white of an egg, you can see in alumina, ammonium ure, calcirephos, also in borax. So yeah, right. Yeah. So the answer is obvious. It is option B. Select the symptoms of ammonium ure from the following. Thirst for lemonade, it's true. Head and chest symptoms worse in the evening, which is not true. Hemorrhoids after suppressed leukorrhea, that is true. And excessive fatty deposit around the abdomen. So it is obvious 1, 3 and 4 are true. So 1, 3, 4 comes as option C. Okay. And then you have select the symptom not related to ammonium ure. No two stools alike, it is a symptom. Hard crumbling stools requiring great effort. Yes, it is true. Then you have menses, flow more profuse at night, that is true. And now you have scanty perspiration of feet smelling like sulfur, not a symptom of ammonium ure. It is definitely offensive, but not the exact description. Okay, so scanty perspiration of feet smelling like sulfur, it's not at all a symptom of ammonium ure. So the option should be option B. Okay, yeah, yeah. So okay, I think that's the end of the slide. I would like something to add here. Yeah, thirst for lemonade, you also have two other remedies that you have to keep in mind. One is, desire for lemonade. When you see the word lemonade, please remember cyclamen and Sickle-Core. Okay, cyclamen and Sickle-Core also have this desire for lemonade. You have headache aggravation from lemonade in selenium. Okay, so that's all I think you have to remember. Lemonade, please remember the word lemonade is important. So you have desire for lemonade, you have ammonium ure, cyclamen and Sickle-Core. You have headache from lemonade, that is selenium. Okay, I think all other things are pretty clear here. So that's it. Thank you.